At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com. The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
Hey, everybody. Dr. Tom Roselle here, right here on WMAL 105.9 and bringing you the best of natural health care. Going to continue our journey today along your lower intestinal system. What am I talking about? We're going to talk about all the toxins and the cancers and the pain patterns and the degeneration that's caused by your intestinal system, your large intestine, not working the way it's supposed to and moving things as it should, but it doesn't, right? So let me give you some data. First, I want to remind you, coming up this coming Wednesday evening at 6 p.m. at the Roselle Center for Healing in Fairfax, Virginia, Dr. Qinglong Zhang and I will present a night on your lower gut and the things that are happening with it. But let me give you some data on that. And by the way, to register, you can do it by phone, 703-698-7117, or simply go online at rosellecare.com. That's ROSELLECARE.com and register. I'd love to meet you all, and we're going to give you some very specific information that you can take some action steps immediately. With the incidents, how many people actually suffer from constipation in the good old US of A? Some of you think, well, it happens. No, let me tell you something. It's 1 in every 6 people, about 16.6% of the population is chronically, constantly constipated. That is not good numbers. It's crazy. You get into and you start looking at, the statistics on it, but in the United States, approximately, and if I give you the whole numbers, it's 16,666 people per 100,000 people. It translates close to about 1 in every 6 people. So when that takes place, it's crazy, right? We're talking up to something in the neighborhood of 56 to 57 million people. That's one of the greatest incidents of any situation. And, unfortunately, ladies, you're in bigger trouble when it comes to this kind of stuff than guys are, but you still, both of you have a problem. Now, we're talking about something called idiopathic constipation and the prevalence or the burden and what we have to deal with. And it's not just bothersome, but there's so many different things that come about because of that. And that's what I want to talk to you a little bit about today. I want you to really get and understand that what we're focusing on in most cases is the essence of your health across the board, your immune system across the board. One of the primary triggering mechanisms, underlying triggering mechanisms of cancers, other than intestinal bowel cancers. It can cause it in other places. So if that's the case, this is a problem, because we start seeing the spider web going from one place to the other, to the other, to the other, and where it started from. Where it started from is that good old gut of yours, and we have to make sure that we understand it, but more importantly, how do we fix it? When we look at the rate of constipation, it's actually growing quite significantly, exponentially. And we want to make sure that you get it, you understand it. This coming Wednesday evening, 6 p.m., we're going to get into what happens. So if, and we're not going to ask any questions. We're not going to make you raise your hand. I want to give you things that you can go home with, but really understand how this can be resolved. And you have to make sure, these are one of these things that you can't play, the the ostrich syndrome, where you're going to put your head in the ground and kind of not look around, or be the turtle and pull your head back into your shell and say, it's not that bad. It's really not that bad. Well, it can be that bad. So when we look at, the minor complications, we're talking about things that hurt the tailbone, right? Meaning hemorrhoids and fissures and that pressure, that soreness, the inability even to sit properly. But we've got to understand what the deal is. So we're going to talk about that today relative to the things that it can produce that you wonder where it came from. Well, this could be the major matrix, and it's not simply taking Marilax but when you can't poop, your body's in trouble. When you can't go, you got a problem, and you're not alone, right? And even some of the statistics go up to like 20% of the population. That's craziness. But if that's the case, don't you think that you better pay attention and do something about it? So we can look at things if we talked about like injury patterns. We can talk about the things that we eat. We can talk about, psychological problems. Yep, there's a lot of psychological pieces of that puzzle as well. But let's get into the nitty gritty here a little bit. And I want you to really get this. I want you to understand it, and what really takes place. So if you can't move things through, we have to look at the pathophysiology. When I talk about pathophysiology, that means the breakdown, the abnormality of physiological function. And so, we begin to look at environment, but here's the deal. You come in, you got lower abdominal pain, you have bloating, you have discomfort. All of those things can really impact, what you do day to day or can't do or don't want to do. And, say, oh my God, this is, a problem, right? Now, let's kind of take it apart just a little bit. The most common problems that cause pathological dysfunction are things that end up like a piece of brick or a stone or a hard clay in your gut and just don't want to move through. One of the quickest ways of remedying that is making sure you're drinking enough water every day. But a lot of you think that water's for washing and that's about it. So put that and say, okay, do I drink enough water? Probably not. So we need to take a look at the things that can be influenced and across the board finger pointed towards, even psychological factors, including stress and anxiety, that'll cause you to be all tied up. That area of your body has one of the emotional pieces called your feelings, that gut feeling. That's one of the reasons that it got finger pointed that way. But seriously, I'm not trying to make light of it. When you are an ongoing stress pattern, when you have that anxiety that's constant, that intestinal system is either producing it or it's being the other pieces, that emotional pieces, causing that gut not to work the way it's supposed to. When we talk about things slowing down, yeah, I move, but it's, it takes a while to get through, and you start saying that, well, there's reasons that can take place. Your thyroid is one of the main problematic children when it comes to the intestinal system not working the way it's supposed to. Constipation is one of the keynotes of hypothyroidism. And it may be associated with other medications as well, like opioids, the things that this country's addicted to right now, because you're in constant pain, your low back is bothering you, you get migraine headaches, you hurt someplace else, you've got, either myofascial pain or you have, other types of syndromes, and we could list them ongoing. But what does your doc do? They don't try to figure out the why. They give you the drug, and that slows it down. So, we have to look at the beginning stages of Parkinsonian's disease, Parkinson's. The tremors aren't just one of them. The bent over posture is not just one of them. The slow mental processes is one of them. Constipation can be one of the initial signs of Parkinson's disease. And you need to find out if that's the case. So, take a look in your family. Who's got Parkinson's? There's a lot of linkage that says that it may be associated with, a genetic pre-problem, right? Well, let's find out what's going on. If you have other things that are showing up that don't make sense, and you're starting to notice an intentional tremor, you reach for something, your hand started shaking, or you've got other pieces of your body that start acting the wrong way. It can be trauma, it can be blow to the head, it can be an old injury that was never fully resolved. And we can pick those up. There's a way of identifying those very rapidly through muscle function response, uh, testing. The You have to really understand the background, the process on this stuff. Functional sluggishness of the gut is rampant, and it's increasing exponentially. And one of the things, and by the way, uh, I was just sitting here, and Sue, that lady I've been married to for 10,000 years, she just walked in and gave me a note, and said, "Don't forget to talk about the problems, the side effects with GLP-1 that everybody wants to take to lose weight, right?" Well, guess what? Guess what's one of the primary side effects? It's constipation. It's plugging you up. So now we're going to see these numbers that I just quoted you begin to rise exponentially. GLP-1 is not a good thing, my friends. It has too many other side effects. This just happens to be one, and that's why we're talking about it today. But you can ask me more questions on Wednesday night when you show up. If you're looking for all these quick fixes to get rid of your weight, GLP-1 should not be one of them. Because we know now, when it first came out, I said, no, there's issues here. We shouldn't be pushing this stuff. But Wednesday night, the 20th, this coming Wednesday night, join me. I'll talk to you one-on-one. I'm going to stay a little longer, even though that I got to take a flight out on Thursday morning. I'm going to stand there with Dr. Zhang, and we're going to answer your questions, and we're going to make sure that you know how to manage this, or understand that it may be more than just a sluggish gut due to your dietary patterns, or that it's going to cause other problems. Did you know cancers, huge numbers of cancers, predispose from a toxic colon? And so you start going, and ladies particularly, you go and you find a lump and a bump in your breast tissue. That lump and a bump that starts and begins to cause irritation and so forth can be coming from your intestinal tract. That's one of the reasons that I encourage women not to have a mammogram, but to get a thermography done, a thermographic imaging. Thermography centers at Fairfax. The proprietor's Dareth Painter. She's amazing at what she does. But she takes the picture. She works with a group of about, a dozen or so MDs. That's all they do is they read these things. It's the demonstration of a heat signal in the breast tissue that shouldn't be there. And it shows up as the blood supply to the tumor or the cyst is beginning to develop. And so you could do something early, and it's non-invasive. It doesn't cause cancer like a radiation platform does. What's radiation? That's called mammography. Mammography has huge amount of radiation that you're using to be preventative, right? To go find out if something there. And it's got a huge, at least a 30% combination false positive, false negative visualization, where thermographic imaging does not. So I would encourage that. We'll talk a little bit about that on Wednesday evening as well, and why it's one of the best, in my opinion, diagnostics for a lot of different things it can do. But so, there was, if you go back and you start looking at the practices that surround what we call pathophysiology, and here's the situation. According to a study some years ago on constipation, a patient must have experienced at least a couple following symptoms over 6 months before they can finger point, with fewer than 3 spontaneous bowel movements per week. My friends, you have to move your bowels once a day, minimally. Preferably every time you have a good-sized meal, you should be moving your intestinal system. 3 times a week, you're constipated. You are stuffed and full. It's, and then if you have to strain more than 25% of the time that you're trying to have the bowel, it should be easy. It should be passed through. Shouldn't have to bear down. It should be once and done. Most of you don't get that. That's called constipation. And, it's an ongoing process. We kind of massage over things. Because why? Because there are a lot of people who experience these and say, well, they're not sick, so it must not be a problem. Well, I'm here to tell you that it is a problem, and it begins to begin to change many things. We talked about how it changes the gut, but I want you to focus on the neurological problems of Parkinson's and Alzheimer's and other neurodegenerative diseases. I want you to think about the cancers that may show up and nobody knows where the heck that they came from. Well, there's a lot of evidence if you really dig deep into the information, like so many things they don't want you to read and see, like through the years of COVID, they hid all that stuff from you. And I was one of the crazy people out there that said, listen, this is what's going on. Well, I'm telling you here again that you have to pay attention to the reasons, not only one that you're constipated, it could be a blow to your back, it could be an injury, it could be a blow to your head, it could be dietary patterns. At the end of the day, if that intestinal tract is not clean and clear, you're going to end up with all kinds of problems. You're going to get these pocketing in your gut. They're called diverticuli, and they get big. When they're diverticulitis, it's because they're framed. They're you know when you have the problem there, what happens is these outpocketings push and they impact fecal matter in there, and then they get irritated and they flare up. And now you have what? You have diverticulitis. It's an inflammatory reaction, and that's the pain pattern, and it hurts, and you end up with major, major issues. Look, I don't want you to suffer. That's my whole piece. I don't want you to suffer. And I'm going to give you all the information this Wednesday night. Join me. These programs that we do in-house are our gift to you as a community because we feel that you have to have the data. We can help you. Sure we can. There's lots that we can do. We do it without drugs. We do it without surgery. And we look at a place of showing you this is what's going on. This is where it's coming from based on history, based on diagnostic examinations the right way, looking at pulse points, looking at muscles that relate to different organ systems, doing neurological testing, checking to see what actually lives in your intestinal system. And it could be, oh my God, parasites. Well, here's the deal with parasitic problems. The more you're constipated, the more likely it is that you're going to have a parasite living in your body that doesn't want to go away. Do you hear me? The more that you're constipated, the more likely it is that you will have a problem. So listen, my friends, there's a lot of reason for that, but 60% of you are what? Living with friendly parasites. 60% in this country. And some people say it's even more than that. And everybody runs out and say, well, I'm going to get this parasite cleanse. So that's not how you do it completely to get rid of it. First, you got to understand how it got there in the first place. Secondly, not only get rid of it, but did it do any damage along the way? And if it did, you better do something about it. I'm going to give you one other piece. How many of you have lost teeth towards the back part of your mouth? That has to do with your intestinal tract. Every tooth in your mouth has an organ system that it relates to energetically and neurologically. If you go online and you look up, say, teeth organ relationships, you'll find it. Just get online and check it out, and then go to the images, and I think you'll be really surprised. But we see it all the time. We see people begin to lose bone in their mouth. We begin to see the system break down because the intestinal tract is not working the way it's supposed to. Friends, this is a major situation. Join me Wednesday evening, and let's see if we can walk through this puzzle with you. Let's see if we can make a difference so you can get your life back. If you're not moving those bowels completely every day, if you're not, walking away saying, oh, that was good, and your energy comes up and so forth, if you're throwing little pieces of stone out, if you're, straining and you get a little blood afterwards, that's not okay. It's not okay. You have to make sure that that's that sewer of yours, let's put it straight up, that sewer of yours is working the way it's supposed to be. Otherwise, the bleeding, suspicious of cancers, the low back pain, can cause this. You could even end up with, believe it or not, tinnitus. I had totally forgotten about that. You can get that really lousy droning sound that just doesn't want to go away. It gets better, it gets worse, it gets better, it gets worse. But we've got to get rid of it. We've got to change it. You've got to know what's going on. You have to make a difference. We have to make sure that if you're taking a drug, the opioid isn't causing the problem. If you're constipated and are you predisposed, if you will, to cancers? Well, how about some of you that are on like naloxone or methylnaltrexone and things of that nature? All of these things can cause issues. There are other ways. Don't let your doctor tell you they don't know, that they don't know. Let's fix this. Let's show you a way to get it done. Let's show you that some of these things that you might be ignoring, if you will, can come up and bite you and cause you bigger problems than you want to deal with. We're going to do that Wednesday night. We're going to show you what happens. We're going to walk you through it. We're going to show you how everything is intimately interrelated. It's important that you get it. It's important that you understand it. Look, we're coming up to the end of the program, and we're going to go into the live stream. I think some of it's been posted already, but if you haven't gotten a copy of it, follow me immediately. Go to drtomroselle.com and click on the button. But you should be following me. Check me out on Instagram and Facebook and, all of the different social media sites. We are there. And get yourself educated and reach out and ask questions. I will always respond to you. Remember, I'm here every Sunday for one reason only. You deserve the data, but more importantly, simply, I love you all. You have a great day. Let's go to the live stream right now.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder is a very painful disorder, which only a skilled neuromuscular dentist can diagnose and treat. If you're in pain and suffering from TMJ, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMJ and how Dr. Michael Chung DDS has successfully treated patients. Visit softtouchdentalcare.com or call 703-319-6990.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend Constipation When the Going Gets Tough on Wednesday, August 20th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies, or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.